Welcome back to the American College of Surgeons Bulletin Brief from the Frontline Surgeons Voices. With me today is Dr. Deepak Nair, and Dr. Nair is the Pillar Lead for Education for the Board of Governors. Welcome, Dr. Nair.
Thanks for having me, Steve.
Great to have you with us. You lead an important initiative, being the Pillar Lead, being the governor responsible for education. Towards that end, perhaps you could tell us a little bit about some of the initiatives that your group is tackling this year.
Yeah, the pillar really helps direct the governors who are focused on the different work groups for education. We have 3 work groups, one of them being the continuing education work group, which really focuses on continuing education for our members at the American College. And this group is headed by Dr. Radan from Orlando and Dr. Joshi, who's from South Jersey. And they're really doing important work. One of the works that they're looking at is video-based reviews. Education and accreditation is sort of going to be more objective with more video-based reviews, and it's occurring in many specialties. So they're working on trying to get CME credit for these video-based reviews that the college is already doing, but also expanding on that and trying to get other fields involved and update the rest of the members on the current status of this new initiative that's happening throughout different specialties. They're also trying to almost create a session and bring different groups in the college together so that they can communicate better and share ideas better about topics for the clinical congress, and try to make this a little bit more seamless and open up the black box. And that's probably going to happen in the early summer. So they're doing really important work in that work group. Our other work group is the patient education work group. And I think they're doing probably the single most important thing that our members should probably utilize. And that's the patient education website. The education material from the college has really been one of the best things that the college provided for its members. But now in the virtual world, our workflow's changed. You know, we sort of have this call where we're talking, but I can't give you a handout saying, look, this is what we talked about, which is what a lot of us do in the office, right? So the patients can sort of digest the stuff that we've told them when they go home. But when we're doing a televisit call or video conference call, it's just not doable anymore. So the college now has a program, and it's really been updated. So the material is very up to date, looks great, where you go on the college's website and you just link it to their phone as a text, as an email, so they get this handout. So your workflow is essentially the same as you would do in the office. So very, very important work and very robust. Our last work group is the surgical training work group, and they have a robust agenda, but they're working on so many important topics that are really needed from our members. One of them is, how do we deal with applicants who are coming in without grades and lack of board scores and a lot of these things that we have to sort of navigate. Also trying to give us more tips on interviewing via Zoom, which is probably going to stay, which will probably increase access, but it's not so intuitive, and the tips and tricks, as well as updating the residency guide for surgery, the little red book, which some of us remember, but making it more robust and working on that. So they're doing a lot of work on those who are teaching residents and medical students and updating them on all the vast changes that have really happened in the past 2 years. I think all of which is good, but certainly we have to navigate what's occurring. In addition, we have a lot of liaisons with the college and their different committees on education, namely the Clinical Congress Committee, as well as the Committee on Bioethics, which is very active, run by Ron Dahlman. We have a big pillar, as should be expected, with the college's focus on education.
That's great. A lot of work being done in important areas. Perhaps you could give us 1 or 2 examples of some of the patient educational materials that are out there. What type of information could a patient get relative to an operation or a disease?
Very specific stuff, especially, one of the ones I saw was the one on breast disease. Tom Squires, breast surgeon in Oklahoma, who runs that work group, is doing a fantastic job. He demonstrated to us real time what he does with these patients. So if a patient comes in and is getting a breast biopsy, whether it's stereotactic, whether it's open, he'll provide pre-care, aftercare. There's also ERAS on there on, what to do pre, post nutrition. You can sort of drill down. One of the other members in the group told us about colon resections, something I think you know about, Dr. Wexner. And I talked about the ERAS protocol there and really drilled it down. ERAS has their own, but this brought it in and the specific things that they can do, and not just preoperative care, but postoperative care. And the handouts are right there. They're online. They don't have to stuff them in their pocket. They can save them. So very important work, and I think very useful.
Fantastic. A lot of great things being done. Last question, you're a vascular surgeon, the value of the college for specialty surgeons like vascular surgeons.
It gives us a bigger home, it gives us more bandwidth, and gives us bigger coattails. I love going to my vascular surgery meetings, but I really get a chance to touch base with other surgeons that I've worked with, and I feel like a much bigger community that it provides me, as well as a lot of these resources are things that we don't necessarily have, specifically the educational resources, the patient handouts that are able to be used in telemedicine, but also the training updates that we're getting from surgical training and other continuing education resources that are directly tied back in to the American Board of Surgery. And it's much easier to get your CME here, and it goes straight to the American Board of Surgery, as well as all the other requirements that it's needed for reaccreditation. It makes accreditation a lot easier.
Thank you very much for your time today. Great speaking with you. Love your background there. And I know it's not a virtual one. I know you're here near me in Florida, over on the West Coast in Sarasota. So it's nice. We have an advertisement for people who don't live in Florida about how nice it is here. Thanks for your time. Thanks for all you're doing on the Board of Governors, and as well for our specialty surgeons. Nice chatting.
Thank you.